Mr. President, I rise to speak about this impending attack upon the Affordable Care Act, upon the impact that it can have upon the hospitals of our country in terms of draining revenue from them, on the issue of the impact on community health centers across our country and the impact that it can have upon them, upon the impact that the repeal of the Affordable Care Act would have upon the access of those who are addicted to opioids, who need help for opioids, who are in a situation where they are going to need the Affordable Care Act, the access to coverage so that their problems can be taken care of. So this is no small threat. This, in fact, goes right to the core of what started in Massachusetts back 10 years ago, when we, as a Commonwealth, decided that care for people who needed health care was going to be made available to them. Now, we have proven in Massachusetts that we are able to provide health care for 98% of our population, while at the same time having an unemployment rate at 3.2%, while simultaneously having the highest scores for kids in the 4th, 8th, and 10th grades in math, verbal, and science, while having the strongest protections for the environment in the United States, while having an energy efficiency standard that is the tops in the United States. We have proved conclusively that it is possible to ensure that people do, in fact, receive access to the health care which they need, while simultaneously discharging our responsibilities to the economy, to education, to the environment, to all of the other interests, all of the other important stakes that we have in our country, to ensure that they're given the attention which they need. It would be tragic if what we did as part of the Affordable Care Act was to once again flood the emergency rooms of America with people who otherwise would have had health care coverage under the Affordable Care Act. That is a system which we have used for 100 years, and it doesn't work because it winds up with the insurance rates of people who do have coverage going up in order to cover it. It winds up with the whole rest of the medical system in a very chaotic way being forced to deal with the consequences. If we begin simultaneously to defund the community health centers across the country and their ability to provide health care, then what we have is a cascading impact that ultimately hits those people who are the poorest, those people who are the most vulnerable. They are the ones who are caught in the crosshairs of this incredible, almost unbelievable attack which the Republicans are waging upon a healthcare system that has already transformed the lives of 22 million people in the United States. It is unimaginable to me that we could be in that kind of a discussion right now on the floor of the United States Senate. But I understand it. This is ideological. It is something that is completely and totally detached from the reality of the benefits of the Affordable Care Act, as they have, in fact, already positively affected tens of millions of families inside of the United States. So This week, we're about to have an incredible battle, which is waged against the Affordable Care Act. But understand this, right in the crosshairs are the hospitals of our country. Not just the famous, big hospitals that we all know their names of, but Catholic hospitals across our country, hospitals that provide the service for people now under a much more orderly system than they would have done so if we had never put the Affordable Care Act on the books in the first place. And so at the forefront of all of these issues, though, is this largest of all public health epidemics that has ever faced the country, the heroin and prescription opioids epidemic, like OxyContin, which are claiming the lives of more than 90 people every single day across this country. In Massachusetts alone, when all the final numbers have been gathered, 2,000 people will have died in the state of Massachusetts in the year 2016. 1,500 of them will have been found to have had fentanyl in their blood system. This is an epidemic of unbelievable proportion. Fentanyl is the Godzilla of opioids. It is powerful, it is deadly, it is knocking people down in the streets all over Massachusetts, all over New England, all over our country. People are being robbed of their potential and God-given abilities from this epidemic that knows no socioeconomic, ethnic, or political boundaries. And Congress has recognized the importance of tackling the tsunami of heroin and prescription opioid addiction that is laying waste to these communities. Just 1 month ago, right here on the Senate floor, Republicans and Democrats came together and passed a bill to provide $1 billion in new resources to states to address the opioid crisis. Resources that can be and are being dedicated to increasing access to treatment for opioid use disorders. Yet today, pending before the Senate is a Republican budget which entire premise is to repeal coverage of the exact same vulnerable people who need access to treatment. Not only is that nonsensical, it is downright cruel for all those families and individuals who finally felt a sense of hope, the hope that new resources could mean the difference between life and death for their loved ones. If you kicked this policy in the heart, you would break your toe. That's how heartless it's going to be in terms of its impact upon ordinary families. With this budget, Republicans are repealing the hope that has given families a reason to ensure that they will have the coverage. This is going to make the problem even worse. Medicaid pays $1 out of every $5 for substance use disorder treatment in the United States. Without federal investment in the Medicaid program, states like Massachusetts, New Hampshire, Ohio, West Virginia, and Kentucky that are bearing the brunt of the opioid epidemic today will have to find even more money in their already dwindling state budgets to aid those who need treatment. But we all know what happens in this scenario. When states can't find that money, the most vulnerable among us, the ones who don't have a voice, are the ones who will suffer the most. The repeal of Medicaid expansion would rip coverage from an estimated 1.6 million newly insured individuals with substance use disorders. And at the same time, repeal will put big insurance companies back in charge. If the Republicans have their way, insurance companies would be able to discriminate against people, including individuals with a pre-existing condition like an addiction disorder. OxyContin, heroin, fentanyl, coverage gone under the proposal which the Republicans are making out here on the Senate floor this week. Let us recognize that the Republicans are not just repealing Obamacare, they're repealing hope. Those suffering from addiction don't have time for Republicans to come up possibly, maybe, potentially soon, sometime in the indefinite future with a replacement plan. These are 1.6 million people who have insurance for substance disorders right now, for heroin, for OxyContin, for fentanyl. These are the people who could potentially die because they don't have medical coverage. What's the plan that the Republicans have to deal with these 1.6 million people who are already under a substance disorder medical coverage plan? What's their plan for these families who are already desperate for the medical help they're going to need in order to stay alive, in order to get the help which they and their families need? Those families know that any delay in a replacement being put on the books could be the difference between getting clean or getting buried. This repeal effort is the worst kind of bait and switch. And it's happening at a time when the American people can least afford it. And repeal is being done at the same time the Republican budget gives billions, tens of billions, hundreds of billions of dollars to corporations and to the wealthy in tax breaks. So look at that as the balance that we're talking about. 1.6 million people who have an addiction, a substance abuse problem. They lose their coverage, but billionaires and corporations get the money through tax breaks that are going to be saved from cutting these programs for those who have a medical problem. That is immoral, ladies and gentlemen. That is just plain and simple immoral. You cannot give tax breaks to the wealthiest in our country until you have taken care of those who are the sickest, until you take care of those who are most in need, until you take care of those with substance abuse disorders in our country. It is immoral to cut the programs so that you can give tax breaks to the wealthiest within our society. We will not save lives and stop this scourge by paying lip service to providing treatment. But this is not the only casualty of this misguided budget before us. The hospitals that each and every one of our constituents depend upon are also at risk. The Affordable Care Act became law in no small part due to the support of those hospitals across the country. During that debate, they knew full well that the impact that a lack of insurance had not just on individuals, but on the entire healthcare system. The hospitals are on the front lines of witnessing the financial burden that uninsured patients have on the system. We tell them that they can never turn away a patient in need. And then when these patients cannot afford to pay for the care, it is up to the hospitals to foot the bill. So the hospitals told us that if we work to reduce the number of uninsured that they had to care for, then they would help us pay for improving the entire system. They did pay, and in no small part, that is why we have a new system in our country. As part of the ACA, the hospitals agreed to give up over $150 billion in payment reductions between 2010 and 2019. And those payment reductions came largely from Medicare and were attacked relentlessly by opponents of Obamacare as an act to destroy the program. But the prophesied destruction did not occur, and the impact on Medicare has been quite the opposite. Since passage of the Affordable Care Act, Medicare has seen its lowest per-member rate of spending growth in its 50-year history. Premiums paid by enrollees in Medicare Part B and D have gone down. And perhaps most importantly, the savings have contributed to keeping our promise to America's seniors by ensuring that the program will continue to be there for them. Medicare's projected insolvency in the year 2017 has been extended for over a decade. All of this is possible thanks to America's hospitals. Here's what the Republicans are saying to grandma and grandpa. Yes, the Affordable Care Act extended the solvency of Medicare 10 years beyond 2017. We're repealing that bill. So insolvency comes almost immediately to the Medicare system. What a great signal to send to grandma and grandpa this year with this bill out here on the Senate floor. Insolvency of the Medicare system. The one thing that grandma and grandpa, and by the way, everybody else inside of every family in America is depending upon to take care of grandma and grandpa. So will the budget before us return the savings that they're expecting from this bill to the hospitals to help them cover the cost of grandma and grandpa? No. For that to happen, Medicare costs will go up. Higher costs will lead to higher premiums to every enrollee in Medicare Parts B and D. Those higher costs will also be realized in the entirety of Medicare Part A program, reducing the time of insolvency from 2028 down to 2024, 2023, 2022, or even earlier. These results are unacceptable to the members of this chamber and to their constituents. So it is now going to be an historic debate, which we have. We can decide instead to simply not cut off the 20 million Americans from the insurance they need. We can ensure that hospitals have the resources to focus on the care for patients when it matters most. And we can keep the promise to America's seniors that Medicare will be there to cover their needs when necessary. I thank you, Mr. President, and I yield back the balance of my time.